Dr. Richa Singh, Senior Infertility and IVF Expert from Max Healthcare, Saket, Panchil Park, and Max Gurgaon. And I'm also available in Lucknow on every weekend. So I welcome you all to this live session of Urvara on this wonderful Saturday evening. And I hope you all are keeping safe yourself in this COVID times. So today we're going to talk about low AMH because this is one of the very common problems people are facing. और जैसे ही AMH की report low आती है, patients really get worried, and then they start thinking that will I be able to conceive or not? And then they start meeting doctors, specialists, and if someone tells them that you would be needing a donor egg, it becomes a real challenge for them to accept it because still in our Indian society it is taken as a stigma and people really find it difficult. It's to that extent also that बहुत सारे लोग अपना ट्रीटमेंट भी नहीं लेते हैं just because कि उनको डोनर एग पे जाना पड़ेगा. So this session is basically for those couples who are facing this problem, and this is going to be a hope to them that every low AMH does not need a donor egg. The only thing is we should know that how low is too low for us to go for a donor. So आगे बढ़ते हैं. सबसे पहले ये जानते हैं कि what exactly AMH is. So AMH is basically the pool of the follicles which are present in the ovaries, जिसको कि हम ovarian reserve भी बोलते हैं. और यही follicles लेडी के पूरे साइकिल में ग्रो होते हैं, मैच्योर होते हैं, इन्हीं में से कोई ओव्यूलेट होता है, फर्टिलाइज होते हैं और इनसे बेबी बनता है. सो जब इनकी क्वांटिटी कम हो जाती है, देन वी कॉल इट एज लो AMH. If we measure it in the values, so any lady who is less than 35 years of an age, if have AMH of 1.5 to 4, it is considered to be normal. If it is between 1.5 to 1, it is low normal or a borderline. If it is less than 1, up to 0.5, it is low. And if it is less than 0.5, then it is very low. So how do we correlate that? So we assume that if the AMH levels are between 2 to 3, the ovarian reserves are reassuring. And if it is between 1 to 2, the reserves are borderline. That means the follicles are decreasing in size. And when the levels are below 1, that means the follicles have depleted drastically and the reserve has gone poor. That means it's not only the quantity of the egg, but it is also the quality of egg which is decreased when the patients are having a low AMH. But the good news for my audience is that AMH level alone are not the indicator of ovarian reserve. It is not the only deciding factor for a donor egg. So what we do is we clinically correlate this AMH with the ultrasound findings. So basically साइकिल के डे 2 पे TVS अल्ट्रासाउंड कर जब हम ओवरीज को ऑब्जर्व करते हैं तो उसमें ये छोटे छोटे फॉलिकल्स बिटवीन 2 to 8 mm are measured and seen that how many counts are there. And if these counts are like 7, 8 or 8 to 10 in each ovaries, then they are supposed to be an average normal antral follicle counts. But if the follicles are less than 6, of course, it tells us that the reserves are poor. And if it is more than 16, it also tells us that it might be a case of polycystic ovaries. See, in this picture, you can see that this is on one side, it's the picture of a normal ovarian reserve, which appears on an ultrasound. And the other side, there are hardly any follicles in the ovaries in cases where the AMH are very poor. So now you saw that AMH is not the only factor. We have to correlate with the ultrasound. And second correlation we need to know is with the age. Because हमें ये भी मालूम होना चाहिए कि हमारे age specific क्या AMH होते हैं and how low is too low. For example, any lady whose age is less than 30 years would have an average AMH above 2. A lady who is between 30 to 35 should have an average AMH of somewhere around 1.7. 35 to 40, average AMH of around zero point 0.8, and beyond 40, around zero point 0.5. So, for example, any person has got an AMH of 1.5. So, if her age is less than 30, her impact would be different. If her age is more than 30, her impact on the pregnancy would be different. So, you see, there are so many things that AMH alone cannot decide, and everything has to be correlated. So, you do not to worry that if your AMH is low, you would be needing a donor egg and the life has come to end. You just need to leave all those worries, fears, and doubts besides you and just progress ahead. And how to progress? Prompt action and right planning with the right expert. Because at this step, choosing your expert is a very crucial thing. Somebody who is expertised with dealing with complex cases and low ovarian reserves would be the right ones for you. Now, how do we plan such patients? So, basically, if you're coming with a low MH, there are other factors also to be considered, like what is your age that we discussed, what is the marriage duration, and for how many years you have been trying for the child. Other co associated factors like endometriosis, tubal blocks, or any other pathologies. Any male associated factor, and what is the quality of sperm. And if you are taking a treatment, then what kind of a treatment are you taking? Like ovulation induction, medications, or IUI treatment. ये सारे फैक्टर्स को कंसिडर करके ही we can come to a conclusion that whether you are a person who requires an IVF, or if require an IVF, it would be either with self eggs or with donor eggs. And now, if we proceed for your self eggs, so one has to also see that how IVF is going to work in those situations. So for that, हमें AMH का कुछ करना पड़ेगा. So what can be done about this low AMH? So don't lose hope. There are a lot of medications and latest treatments available to improve the quality. And one most common medication that has been given to such couples is DHEAS, that is dihydroepiandrosterone. हाउ डज इट हेल्प? जब हम DHEA सप्लीमेंटेशंस वुमेन को देते हैं, सो ये FSH के रिसेप्टर्स पे काम करती है, फॉलिकल्स की ग्रोथ को बढ़ाती है, उनके डैमेज को कम करती है एंड वेरियस ग्रोथ फैक्टर्स को इंक्रीज करती है. एंड इन सब का क्यूमुलेटिव इफेक्ट ये होता है कि आपके नंबर ऑफ oocytes बढ़ जाते हैं. अगर नंबर ऑफ एग्स बढ़ जाते हैं तो उनकी नंबर ऑफ एम्ब्रियोज भी बढ़ सकते हैं, उनकी क्वालिटी बेटर हो सकती है. Your oocyte yield and ovarian reserves increases, and it also works on your ovarian response. क्योंकि अगर आपके follicles बढ़ गए हैं and अगर they are not responsive to the medications that we are going to give it to you, then also the whole scenario is going to be a waste. So it works on all the channels. And ये optimization around 1 से 3 months तक का हो सकता है. And once your AMH level comes to a better optimum criteria, then you can be taken up for your IVF treatment. And IVF, maybe there are many protocols which can help the couples with low AMH to conceive. They can be a conventional stimulation, they can be a minimal stimulation protocol, we can do pooling of the eggs. So there are a lot of things that can be done for such couples. So you see, there is nothing like that if you have had a low AMH that you have to go for a donor. The only thing that is important here is that when we go with IVF with low AMH, the success rate decreases a bit because, of course, the quality of eggs are not that good as compared to your normal counterparts. So, for example, we talk about 4 situations. Now, in left-hand side of the situation where women are less than 35 years, so there are 2 situations. One is that a lady who has a good count of more than 5 and AMH is more than 1.2, while on the other hand, a lady who has a follicle count of less than 5 and AMH of less than 1.2. So, क्या लगता है जो ग्रुप 3 है यानी कि जिनमें फॉलिकल काउंट्स एंड AMH कम है उनकी of course the prognosis of conception and IVF success will be lesser than the group which has a better follicle count and a better MH. And similarly, in the age group more than 35, 35 में जिनके AMH कम है, जिनका AFC 5 से कम है, as compared to AFC more than 5 and AMH 1.2, of course उनके results, उनका success rate would be lower. But that does not mean that you cannot attempt the pregnancy. If you are okay with taking that risk, you can always attempt a self cycle, because nothing is like that this cannot happen. But yes, there comes a situation where the indication comes for a donor egg in cases of low AMH. And what are those situations? So, number one is that when AMH is associated with high FSH, ये बहुत important है. अगर isolated AMH कम है, that is a criteria for a poor ovarian reserve. लेकिन अगर AMH के साथ FSH बहुत high है, maybe more than 16, more than 20, this indicates that ovaries are basically gone into ovarian failures, and rather premature ovarian failures, because जो FSH होता है वो हमारी ड्रग्स के रिस्पॉन्स को डिसाइड करता है. यू कैन सी इन दिस टेबल पेशेंट्स जिनका AMH 3 से ज़्यादा है या up till 1 है, they have a normal response, they have low chances of cycle cancellation, and they have a anticipated pregnancy rate with IVF. But जैसे ही हमारा AMH 1 से नीचे जाता है and FSH बढ़ना शुरू होता है, ऐसे केसेस में हमारा cycle cancellation increases, the response decreases, and of course the cycle success rate also decreases. And less than 0.4, this all becomes very low and the chances of cancellation becomes very high. So this is one situation. The best part is कभी कभी ये high FSH transient state में होता है, and with the help of medications we can bring down this LH and FSH. But patients who do not respond to it and their FSH and LH remains constant, then they are the candidates जहाँ पे हमें oocyte donor लेना पड़ता है. Second, where the ovaries have gone into a premature ovarian failure, like AMH has decreased down and FSH has increased, showing a non-responsive nature. The follicles, there are no follicles in the ovaries. So ऐसे situations young women में less than 35 years, almost 1 in 250 women are facing. And in above 40 years, almost 1 in every 100 women are facing. So ऐसे cases maybe we need to switch it over to donor egg IVF. And there is no harm in it. There are many young ladies, 25, 26 years, they have to offer donor egg. And there is nothing to be panicked about. There is nothing to be strained about, because this is what it has been given to you in your body. You have no control over it. So if you do not go for an ovarian, for a oocyte donor, then how will you conceive? Either the adoption is the option, or without a pregnancy is the option. So we also have to see that we have to keep our minds open. And third is, when somebody has attempted with IVF with their own eggs, maybe 1 or 2 cycles, and there is no response and there is no result, then of course we would need to switch it over to donor egg IVF. And what we do in donor egg IVF, we select a lady which matches to the profile of the recipient. बहुत important है मैच करना डोनर को रेसिपिएंट के साथ. सो बेसिकली वी हियर match the recipient in terms of her skin color, eye color, her looks, her height, and even the blood group. And after the matching, we screen the donors and her husband for all the possible infections and the diseases. And once it's clear and she's fine, then we start giving her injections. We give her ovarian stimulation, her eggs are ready, we take it out, we make the baby and transfer into the patient's uterus after her endometrial preparation. So it's not that difficult as well. So I hope this session, I've kept it short to basically make you understand that having a donor egg IVF is not the end of the theory, and also every low AMH does not need that. So There are protocols and treatments where we can optimize patients, and if they respond well, IVF with self eggs can also be attempted because we all are losing eggs at different rates. And if we know our AMH levels and we are keeping a track of them, it is going to help in conception. And last but not the least, is reaching to the right expert is a very crucial step because as it is you are having a very low ovarian reserve, you have a very narrow time frame, and being in right hands will save that time, guide you well, and can help you to give you a beautiful baby. So what you need to do is be patient, stay positive, don't lose hope, trust the process because there will never be a day like the day your baby is born. So I think that is all from my side, and I hope the session has been informative to you. And now the question and answers we can take up. Here is a team which is going to help us in conducting that. So any questions, if anybody has, we can take up those questions because this is a very common problem patients are having. And you can also mail questions to us on the mail ID given below in the bottom, or you can also mail your queries on the number which is being reflecting on the screen, so that or if you want to have a personal consultation, you can have that as well. So this will help you to understand what is your problem and will guide you to a better outcomes. Okay, so the first question is, what is good AMH level for IVF? See, AMH is the indicator of ovarian reserve, and usually, if that is the only cause of infertility in a woman, then of course, less than 1.5, with keeping all other factors, we plan IVF treatments. So we have to see what age a patient is, and then we corroborate her AMH level, and then we decide whether it is suitable for IVF, or we can go for IUI treatments also, because it is not there that every low AMH will be requiring an IVF treatment. Suppose if the age is young, the tubes are open, there is no other pathology, trying for an IUI for 2 to 3 cycles is not a problem and not a harm at all. Yes. Can low AMH levels be improved? So, I already discussed that low AMH can be improved by supplementation of DHEAS, and this is basically given in the dose of 75 mg and once daily or twice daily, depending upon how the patient reserves are. And roughly it takes around 1 to 3 months to optimize. और जब ये आपके levels optimize हो जाते हैं, and if the response is there, then we stop the treatment and then we plan her IVF. because ये जो भी medications होते हैं ये marginal changes करते हैं. ऐसा कभी नहीं होता है कि अगर AMH 1.5 है तो 1.5 से 2.5 हो जाएगा, but of course 1.5 से 1.8 हो सकता है. So we always give that margin that अगर जितना भी maximum improve हो सकता है उतना we try to improve by this medication. Yes. So, what causes low AMH level? So, there are many causes for this poor ovarian reserve, and one is, of course, the stress factors. हमें नहीं पता चलता है, हम लोग इतना stressful life में रहते हैं, where that stress is causing the damage to a reproductive potential, be it in females and be it in males. Then, second, the environmental pollution, the toxins that we are taking inside. हर चीज में adulteration है. So all these chemicals are going inside the body, and they are basically depleting our ovarian reserves. And sometimes there has been any ovarian surgery, or there has been any exposure of chemotherapeutic agents or any radiotherapy. So इन सब से भी हमारा AMH या प्रीमेच्योर ओवेरियन फेलियर होता है, जिससे कि लेडीज अपना रिप्रोडक्टिव पोटेंशियल खो देती हैं. So do Yeah, so next question is that is IVF the only option for low AMH? ऐसा बिल्कुल भी नहीं है कि अगर लो AMH है तो हमें IVF ही कराना है, बिकॉज बहुत सारे फैक्टर्स डिपेंड करते हैं कि कपल का मैरिज ड्यूरेशन कितना है, एंड हाउ लॉन्ग हैज़ बीन ट्राइंग, व्हाट इज़ द मेल फैक्टर, कोई एसोसिएटेड पैथोलॉजीज तो नहीं है, या पहले कोई ओव्यूलेशन इंडक्शन लिया हुआ है कि नहीं हुआ है. इन सब चीज़ों पे डिपेंड करता है. और ये भी डिपेंड करता है कि AMH का लेवल क्या है. सपोज अगर AMH का लेवल लेस देन 1 है, so the time margin with the couples is very less, and in that situations we prefer to step up to IVF. But yes, अगर AMH 1 से 1.5 के बीच में है, कपल यंग है, कोई एसोसिएटेड मेल फैक्टर नहीं है, so 2 to 3 cycles trying for IUI is no harm, because if the couple conceives an IUI, it is nothing like it. But yes, the only thing that low AMH tells us is that this is the high time the ovarian reserve has started depleting. So we have to be very prompt in our actions. We do not have much time to waste, and we have to be in a process of pregnancy, be it IUI, be it IVF, be it optimization, but we have to be in the process, क्योंकि कोई भी process को करने में भी time लगता है. So that is how we approach. और ऐसा बिल्कुल भी नहीं है कि अगर low AMH है, so अगर borderline है, so IUI can also be attempted in such cases, but not less than 1. That's the cutoff that we take. Yoga. Yes. Can yoga help to increase AMH level? See, yoga is basically going to make you mentally relaxed and will help you with the increased metabolism. So, what happens is that the medications that you are taking to get it optimized, that we talked about, is going to be circulated in a better manner, and it is going to have a better impact on your body. So yes, otherwise indirectly of course it's going to help, but if you talk that in direct response, it has not got a great effect on the AMH levels. It is just going to keep you relaxed and calm, and which is also very important during your IVF treatments. Does AMH is a reason for infertility in males? See, males में AMH का कोई significance नहीं होता है. AMH is a significant factor in females, जो हमारे हमारे ovarian reserves को indicate करते हैं. Males में the hormones to check is the testosterone, the LH, the FSH, and of course the semen analysis, which tells us about the reproductive potential of a male. So AMH has got value in females. So thank you everyone for joining this webinar, and I hope it was informative for you all. And for any queries, you can contact me. And similarly, in this series of Urvara, we will keep bringing you the topics that really worry you, and we would try to give you the solutions so that you can cope up with the situation and take a beautiful pregnancy and a baby home. Thank you everyone, and have a good day.